Dysentery can be defined as a diarrheal infectious disease affecting the intestines, especially the colon, caused by bacteria, parasites, or protozoa, characterized by severe diarrhea containing mucus or blood, fever, abdominal pain, pain on passing stool, foul smelling stool, and tenesmus. So whenever we talk of dysentery, we have to we need to have the picture of the intestines, because intestines are the ones that are affected. So when the bacilli enters into the body, mainly it could be a bacteria or it could be a protozoa, it targets the intestines, and those that are targeted are the large intestines. So as you can see here on the diagram, you can see the intestines that are inflamed. So let's look at the predisposing factors to dysentery. So like I said, dysentery, just like other infectious diarrheal disease such as cholera, typhoid, can be caused by 6 Fs. 6 Fs, we are talking of vomites, food, fluids, feces, fingers, and flies. So what do we mean by vomites? Vomites, those are surfaces. It can be any kind of surface. It's either by touching. So if you touch a surface uh, which contains either a bacteria or a protozoa, which is being contaminated, it means that when you touch it and then you place your hand on your mouth, or maybe you lick your hands, maybe by any means, you can contact this bacteria. And also food, eating contaminated food can be also a predisposing factors. Any food that is contaminated with either a bacillary, uh, uh, whether a bacteria or a protozoa, it can also bring about dysentery. Also fluids, we are talking of water, drinking contaminated water, that is contaminated with maybe the amoeba historica, or maybe the water that is contaminated with the Shigella, because those are the causative organisms. It can also cause a dysentery. Apart from that, also feces, because this disease can also be transmitted through fecal oral route. So meaning uh, this bacilli can be passed through feces, and when when one comes in contact with feces, it can also bring about dysentery. Also fingers, especially those people that do not like cutting nails. So keeping long nails can also uh, be a mode of transmission of dysentery. And also flies, especially living food that is uncovered, the flies can come there. They feed on those food, then they they go and sit on the feces, and through the same way they can bring about dysentery. There are just two types of dysentery. So bacillary dysentery is also known as shigellosis, which means this one is caused by bacteria. And we also have amoebic dysentery, which is also known as amoebiasis, which is caused by protozoa. So now let's look at bacillary dysentery, which is also known as shigellosis. So when you are taught to define bacillary dysentery, this can be defined as this is an acute diarrheal infectious disease affecting the intestines caused by Shigella species, characterized by severe diarrhea containing stool or mucus, abdominal cramp, and fever. So abdominal cramp is also another term which means abdominal pain. Then what is the incubation period for bacillary dysentery? So this one, it can only take about 1 to 7 days. Then there are species, what are species of Shigella, which cause bacillary dysentery. So we have 4 many species that can cause bacillary dysentery, which are Shigella dysentery, Shigella flexneri, Shigella boydi, and Shigella sonei. So these are only 4 species that can cause bacillary dysentery. Then apart from that, like I said, we also have amoebic dysentery. So amoebic dysentery, this is caused by protozoa, and it can be defined as this is an acute diarrheal infectious disease affecting the intestines caused by Interamoeba historica, characterized by fever, hepatomegaly, chronic abdominal pain, and severe diarrhea with mucus or stool. And this can also have incubation period of 2 to 4 months. So amoebic dysentery, and like for bacillary dysentery, we said it can take about 1 to 7 days, which is just within a week. But this one, the incubation period is 2 to 4 months, but it can even last for months to years. Yeah. So the forms of Interamoeba historica. So this one can appear in vegetative form and also cystic form. So that is all for amoebic dysentery. So let's look at the pathophysiology of dysentery. So this pathophysiology, we are looking at it, it can either be for amoebic dysentery or bacillary dysentery, because the stages and the disease progression of dysentery, being it caused by bacteria or the protozoa, is the same. The only difference is minimal, and we are going to discuss that difference, the difference that can happen in bacillary dysentery and also amoebic dysentery. So, dysentery comes about when an individual eats food or drinks contaminated water with feces of an infected person, introducing the bacilli. So the bacilli, we mean it can either be Amoeba historica or Shigella into the gastrointestinal tract. So once one of those, which is maybe Shigella or Amoeba historica, is introduced into the GIT, these bacilli migrate to the large intestines, because the target of this bacilli targets the large intestines. So it migrates to the large intestine and attaches itself to the mucosal lining of the intestine and start causing irritation to the intestinal wall. So once there is a irritation there to the intestinal wall, in response to that, because the intestine, they also have cells, the epithelial cells, which are called the enterocytes. So enterocytes, these are epithelial cells of the intestines. Those are responsible for targeting the foreign bodies and killing them. So because of irritation, these enterocytes, which are epithelial cells of the intestines, will respond to the irritation, and then they respond by secreting fluids within the intestines. So they will start secreting fluids within the intestines. Then after that, because of there will be continuous irritation to the mucosal lining. As a result, there will be inflammation. Because of continuous irritation, there will be inflammation, and there will be also ulceration of the intestinal wall because of antigen antibody reaction. You know, when there is a reaction between the antigen, which is the foreign body, and also the antibody, those that fight in the body, that fight the bacteria or any or protozoa in the body, there'll be reactions. Then that's why there'll be inflammation and ulceration. And because of inflammation and ulceration, this will result into bleeding within the intestines, causing severe diarrhea with blood and mucus because of bleeding. At the affected site, or the lesions will form, the bacilli will perforate the intestinal wall and enters into the bloodstream and transported to the adjacent lymph nodes, causing fever. So because of perforation, because of perforation, that's why we are saying that this bacillary will gain access to the bloodstream and will go to the lymph nodes. Lymph nodes are also part of immune system, where there are white blood cells. So whenever the bacillus enters into the bloodstream and they go into the nearby lymph nodes, it means that there will be those white blood cells. They'll start fighting this bacilli, meaning there could be Shigella or Interamoeba. They'll start fighting, and whenever there's a fight, there'll be a fever. This will start causing fever. So all in all, what I'm saying is that whenever a virus or any bacteria or any protozoa gains access to the bloodstream, whenever they are present in the bloodstream, there'll be a fever. So this is where bacillary dysentery ends from. So whenever you are told to discuss the pathophysiology of bacillary dysentery, then we are saying that once the bacilli or once the bacteria, which is the Shigella, enters the bloodstream and travel to the nearby lymph nodes, causing fever, that's where this pathophysiology ends from. So it does have to end there. So that's the only difference between the pathophysiology for bacillary dysentery and amoebic dysentery. Then what is the pathophysiology for amoebic dysentery? For amoebic dysentery, it means that when the Interamoeba historica gains access to the bloodstream, for it doesn't end there. It enters the bloodstream and goes direct to the liver and start destroying the liver cells, causing hepatomegaly. So that's where the pathophysiology for amoebic dysentery ends from as well, because the target of Interamoeba historica is the large intestines. After causing irritations, perforation, then gains access to the bloodstream, then it targets the liver and starts destroying the liver cells, which causes hepatomegaly. That's where you find the hepatomegaly is one of the complications of amoebic dysentery. Yeah, so this is where the pathophysiology ends from. So what are the signs and symptoms of dysentery? So signs and symptoms of dysentery: one, there is fever. due to presence of bacilli in blood. So like I said, this bacteria, which is the Shigella or maybe Interamoeba historica, will gain access to the blood after perforating the intestine. So we'll gain access into the bloodstream, and whenever these are present in bloodstream, there will be fever because the body will react to the foreign body, causing fever. So there will be also diarrhea with the mucus and blood due to irritation of the mucosa lining the stomach. Like I said, from the pathophysiology, because of the irritation, this bacteria may start irritating the mucosa lining, and as a result of the irritation, there will be mucus or blood within the mucus or blood within intestines. Then there will be also abdominal pain, which is due to irritation of the intestines. So whenever the intestines is irritated, because intestines are part of intra-abdominal organs. So any intra-abdominal organs that is inflamed or that is irritated, it can also cause the pain on the abdomen. So that's why there will be abdominal pain. There will be dehydration due to excessive loss of fluids through diarrhea. Because of, we said once the bacilli uh, start irritating the intestine with intestines, we said the enterocytes, those the epithelial cells of the intestine, they start secreting fluids within the intestine. So those fluids, they will be passed through diarrhea, and as a result of that, it will bring about dehydration. The patient will be dehydrated. There'll be body malaise due to excessive loss of electrolytes through diarrhea, because the patient will have severe diarrhea. So the electrolytes will be lost, causing body malaise. Tenesmus due to rectal irritation. So the rectum will be irritated, then the patient will be feeling like passing stool, but the bowel is empty. That's where you experience tenesmus, and that's what tenesmus is. When somebody is feeling like passing stool, but the bowel is empty. So that is tenesmus. Then we also have thirst. The patient will experience a lot of thirst due to excessive fluid loss. Then for amoebic dysentery, we said that the amoeba historica will gain access to the bloodstream, then it will travel to the liver, because that's where it will start targeting the liver and start destroying the liver cells. Because of that, it will cause there'll be hepatomegaly due to invasion of the liver by the amoeba historica. So this sign can only appear in amoebic dysentery and not in bacillary dysentery. Let's talk about the preventive measures. How can we prevent dysentery? So dysentery, uh, you can prevent dysentery through hand hygiene. So we said this bacteria or amoeba can be transmitted through hands. So you have to make sure that you wash hands with soap after using toilet and before eating or handling food. And also under hand hygiene, other points that you can put also, you should make sure that you avoid handshaking, because you may find that other people, they are not washing hands, they are not washing hands, and then you shake hands, you transmit that bacteria. You have to make sure that you avoid handshaking, and also you wash hands always. And apart from that, you have to talk about the you have to do safe water drinking. You have to make sure that the water that you are drinking is very treated. It can be treated with chlorine. You make sure that you add chlorine, or maybe by boiling water, or or maybe by filtrating. So any mean that you can use to treat water, maybe the using filtration process, or maybe boiling. But the most effective way of water treatment is chlorine. Make sure that you add the chlorine. Then you have to do proper sanitation. So proper sanitation, we are talking about making sure that the drainage systems are proper, they are not damaged, because if they are not damaged, you find that the same drainage is pouring into the water body. It could be maybe the river, the lake, and that's where people fetch water from. So meaning that the water can be contaminated, and when you're drinking, it can cause infections. And the same water, if not by drinking direct, others can also use the same water in the farms where they may be irrigating the crops, and because they contain the bacteria and also the the amoeba, which means that when somebody eats vegetables, you can acquire this you can come up with this condition. Then also you have to make sure safe disposal of feces, especially for the babies. We have to make sure that those are the feces in the diaper properly disposed of in the toilet and not throwing anyhow. And you have to make sure that also as you are doing that, you maintain the cleanness. You wash hands and everything, and you also wash the baby's clothes and napkins to make sure that the, the everything is very clean. Then you also have to make sure that under proper sanitation, you have to make sure that also you avoid defecating on the legs and rivers. Make sure that uh, you build toilets and you defecate from toilets and not anywhere. Maybe also there are people who have the tendency of defecating from the bush, so that is also unhygienic. So you have to make sure that you maintain, or you maintain the preventive measures through doing proper sanitation. Then you have also to talk about the food hygiene. So food hygiene, you have to make sure that whenever you are eating food, any kind of food, you have to wash the food and also cook thoroughly to make sure that the bacteria that is involved is also killed. So you have to make sure that the fruits, the vegetables, before you prepare them, you wash them well, so that you don't transmit this positive organisms. Then also the other preventive measures is early treatment. So early treatment, you have to make sure that whenever you experience any sign symptoms such as diarrhea and fever, you have to seek the medical attention immediately. You can either visit the clinic or the hospital so that they can attend to you. And when the condition is early identified, it means that the treatment is easy as compared to when you delay. Because if you delay, it means that you will also be transmitting the same bacteria to other individuals. So I have to make sure that the condition is very identified and treated for. So apart from that, having looked at the preventive measures, we can talk about the complications of dysentery. So like I said, one of the first complications that we can talk about the dysentery is the intestinal perforation. That's where I said that where from the affected side of the intestines, there'll be irritation. This bacteria will irritate the intestine, or after irritating, there'll be inflammation, which will also cause ulceration. Because of that, the intestine will perforate. So there'll be intestinal perforation due to deep ulceration of the intestinal. So in this condition, that's where you find that now there'll be severe bleeding. And once the intestines have perforated, it means that this becomes an emergency case because there'll be bleeding within the abdominal cavity. And once there is such, it means that the patient may require an emergency pre-op. So whenever you are studying, make sure you have to combine, make sure that you know the link between dysentery and also intestinal perforation, because this can result into dysentery can result into intestinal perforation, which can cause emergency pre-op, and the patient may be rescheduled for surgery, meaning that they can suture the perforated intestine in order to arrest bleeding. Then there's also hypovolemic shock. So this one will come in due to increased loss of fluids and diarrhea, and there will be also liver cirrhosis or liver abscess. Liver abscess, which is due to spread of amoeba from the intestine via hepatic vein, forming an abscess. So this complication can only be found in amoebic dysentery. Like I said, to say that the only difference between amoebic dysentery and bacterial dysentery is that the amoeba are getting access to once they gain access to the bloodstream, they travel direct to the liver and start destroying liver cells. That's why you even find the liver abscess, because of the inflammation that will be caused by amoeba in the liver. But for bacillary, the pathophysiology just ends where the bacteria, which is the Shigella, once it enters into the blood stream and it starts causing fever and also affecting the nearby lymph nodes. That's where the pathophysiology ends. Then another complication, there'll be lung suppuration, which is due to spread of amoeba or Shigella to the lungs. So it means that once they gain access to the bloodstream, they can also spread to the lungs, causing lung suppuration. Then meningoencephalitis, which means this is due to migration of the bacteria to the brain tissue via blood circulation. So once they enter into the bloodstream, this bacteria or the amoeba, this bacteria may start moving into the brain tissue and may cause meningoencephalitis. And there can be also peritonitis, which is due to intestinal perforation or rupture of liver abscess. So whenever, like I said, whenever any intra-abdominal conditions, such as we can say Any condition that affects the intra-abdominal organs, because the intestines are part of intra-abdominal organs, and when they perforate, they can result into peritonitis. So intestinal organs, we're talking about the stomach, the liver, the intestines, the pancreas. So all those conditions, once they perforate, which means that they can be peritonitis, which is the inflammation of the peritoneum. Then anemia can also be there due to intestinal bleeding, because where the perforation occur, it means that there will be severe bleeding, which will result into anemia. Then there will be also rectal prolapse due to tenesmus. Like I said, tenesmus, this is where the patient is feeling like passing stool, but the bowel is empty. So meaning that he will be forcing himself, and by doing so, the rectum may be prolapsed. So that's why you find that there will be rectal prolapse. Then there will be septicemia, which is due to presence of bacilli in blood. Okay, so those are the complications, and this is where we end with today's presentation on dysentery. Thank you for paying attention.